My name is Dr. Yasser Falah. I'm a consultant neurologist based at King's College Hospital in London. That's where I do my NHS practice, and I also have a private practice based on which is based at the different locations. So I came from a medical family. Both my parents were doctors, and I think when you're raised in a house where your parents are doctors, it's something that becomes one of the options as a future career. And I have to say, despite the struggles that I've seen them go through in terms of doing their exams and build up their career, it's something that for me became an interest, and I decided to pursue a career in medicine. And I'm happy that I've done that. So neurology is one of the medical specialties. We divide specialties in medicine into medical and surgical. My interest was always going to be one of the medical specialties. Neurology is a specialty which includes analysis and understanding of how the body works, how the mind works, and it does connect different functions of the body. And this, I think, the understanding of this function in early days of my medical career made me like this as a specialty, and I like also the fact that the complexity, I would say, of neurology and the way that we can try to entangle different symptoms and signs and come up with a diagnosis and also the treatment with the hope to help people improve and get better. I think that the ability to help patients and help them understand where their symptoms are coming from. I'd like to share images and pictures with patients and show them how the nervous system works and what is the cause behind the symptoms. Many people feel this is very satisfactory because they come with lots of uncertainties before they see the neurologist. I find it helpful to do the tests that people need and explain the results to them and explain how the different treatments work. And most of the time, this actually, I think that the satisfaction of people's interaction with a neurologist comes before even the treatment starts, because big part of it is the explanation and the understanding of their condition. And that's very rewarding for me. I think they value my ability to listen. I tend to give people enough time to talk about their problems and symptoms, and that's usually an important part of the consultation. Also, the ability to talk to patients in simple terms. I think we are sometimes criticized for using medical jargons or, giving people complex information, which give them probably more questions than answers. And I think the ability to talk to patients in simple terms and explain to them what their problem is, and the ability to listen. These are, I'd say, the things that people value the most. I think patients, the ability of patient to give an accurate information about their problems, and I feel many people who come to my clinic are able to summarize their symptoms and able to give me all the details that I need. I think that's usually something I see a lot in the neurology clinic. And I think again, it's important for patients to listen to doctors and understand what that they are saying in terms of explanation and the way the treatment works. And I think following the medical advice and maybe a little being patient, because many of the neurological problems, they do not necessarily have a quick fix. And I think the understanding of this and then the understanding that the treatment takes time to work, I value this in my patients. One of the catchphrases which I use regularly is if you don't use it, you lose it. And that's probably used by many of the neurologists. It's used in people who present with inability to use one of their limbs, whether it's the arm or the leg. And that could be, regardless of the cause, it's the subconscious reaction to it is not to move that part of the body, either because of discomfort, because of pain, or because of true weakness. In all circumstances, I advise people to try to use their arm or their leg, because otherwise you will lose the function. And the longer this goes, the more difficult it is to reverse it.